Hi everyone, I'm Jules. The question was, what happens in a speech and language assessment? So basically, they can go for anywhere of like an hour or so, and they are picture-based, play-based, really fun. Your child won't always feel that they're being assessed, although obviously we will be asking them lots of questions, but we do it in a way that's fun and low pressure. So it doesn't feel like a hard test, and there's lots of play and movement involved. So this means toys, bubbles, and basically this is one of the most common assessments. It's for children aged 3 to 6 years, 11 months. So pretty much that early intervention year, all those early intervention years. So this is a standardized language assessment, which means that the scores tell us how a child is going for their age group. And the results will either be within normal limits, mild delay range, moderate delay range, or severe delay range. If your child does score within mild, moderate, or severe delay range, there are some options to help support your child so that they continue to learn and grow and meet their potential. And in Australia, obviously, if a child falls into categories such as even moderate or severely delayed ranges, they are sometimes eligible to access some funding types. So for speech therapy. So here you can see it's divided up into different categories. So each tab is like a little different subtest, and it'll either be understanding, which is known as receptive. So that's the part where you're not talking and it's pointing. And then the other parts are expressive or talking, or using sight, like using gestures or like nodding, and yeah, obviously using words and sentences. So with this, we do go through each one, show the child some pictures. Sorry, it also has a flip function there. But basically you can see they're nice, clear, easy images rather. And we have a turn where the speech pathologist will ask a question and maybe even give a response, and then the child's encouraged to do so as well. So super fun, super straightforward. They have these in community health as well as private speech clinics. So it's called the Self P3, and it's the newer version. Before we were using the Self P2, but they're pretty similar. So yeah, I hope that answers your question about speech and language assessments. If your child is younger or under 3, they'll be doing an assessment that isn't so much related to pictures and pointing as much. It's more to do with play, have lots of toys and resources. So they might do a PLS 5, which is for really young, for children 0 up to 7, but we typically use it for children under 3. Or for children who aren't using words yet or are developing at a rate that's typically slower for their age. And it's a very play, fun activity assessment tool that we use. But yeah, I hope that answered your question. Feel free to ask any more questions, and I'm happy to give some generalized answers.